Hi, I'm Dr. David Green, Preferred Pain Center here in Phoenix, Arizona. Today I'm at the Phoenix Mountain Preserve, and I'm basically here to talk about the weather. Small talk. The weather in Phoenix is, this time of year, some people would call it ridiculous, and it kind of is. I mean, today it's 110, 111 degrees, and 19 days out of the year in Phoenix, it breaks 110 degrees. It has, in 1990, gotten up to 122 degrees. That's the highest recorded temperature. And the lowest temperature was approximately 100 years ago at 16 degrees here in Phoenix. So it does get cold. It routinely gets into the 30s and 40s in the wintertime. I know East Coast, you're laughing right now. But with regards to the amount of sun that we get, about 315 or more days per year are sunny here. And the number of days it gets over 100 degrees is about a fourth of the time. 90-some days. And real quick, I wanted to define a haboob, H-A-B-O-O-B. We had a big one this summer. The summer is the monsoon season here in Phoenix. A haboob is explained very quickly as this. You have a thunderstorm. Before it starts to precipitate, winds often come into a thunderstorm and trail behind it, go opposite from it. So what happens though is when the thunderstorm starts to actually rain and precipitate, it forces the wind out. And it often goes ahead of the thunderstorm, and it can be 20 to 30 miles an hour. It can be 60 miles wide, it can be 2 miles high, and if you watch the videos on YouTube of the haboob from this summer in Phoenix, it can be scary, very scary, and extremely impressive. So the wind picks up the dust, and it creates a huge dust storm. So the topic for today is inversion therapy. What is it, how well does it work, and what are some things to watch out for? Well, I'll start with an explanation of, let's say you're 6 feet tall on average. Are you the same height? Are you 6 feet tall all day and all night? The answer is no, you're not. People don't often know this, but you're taller in the morning than you are, when you wake up, you're taller than when you go to bed at night. And that's just a simple function of gravity. When you're standing and walking around most of the day, gravity is pushing fluid out of your spine and making you shorter. And when you sleep at night, fluid comes back in. You gain a little height, so when you first wake up in the morning, you're taller. So if you're worried about your height, if you're an athlete and you need to, look taller, make sure you get measured first thing in the morning. But what happens with inversion therapy is basically a patient is inverting him or herself to get rid of back pain. And how is this done? Well, there's multiple different devices that are on the market, and they range from $150 up to about $500 or more. And either your knees get bent over the top of the device and it sort of turns you upside down slowly, or you go into a boot on each foot and that goes up on the table, or sometimes there's a bar and you just put your feet over the bar. So any one of those things constitutes inversion therapy. And it's basically spinal traction by gravity. So your body is the weight, that's providing the traction, and it's continuous. So how well does it work? And the answer is, it works really well short term. So if you stop doing it, the results go away. Because gravity, is gravity, and it's continuous traction. So if you have 10 to 20 minutes twice a day, it can work really well for your low back. And I've already talked about in videos that spinal traction continuous works well for the neck. So 10 to 20 minutes a day, the recommendation is to start out not at 90 degrees, but more like 20 to 30 for a few days to a few weeks, and then increase it to 60 degrees. I'm sorry, I'm going the wrong way. And then up to 90. So that's sort of the recommendation. It's more of a short-term pain relief. A couple things to watch out for. If you have glaucoma or high blood pressure or heart disease, make sure you talk to your doctor first before you do this, because you're going upside down and blood's going to pool, even if temporarily, into an area that already has too much blood or pressure. So you want to make sure that you're not going to make a potential problem into a real problem, or a problem into a severe problem. All right, so there you have it. That's inversion therapy basics. There's a lot of information on our website about spinal decompression treatment, which is different. It is intermittent traction that helps create a negative pressure in the spine, bringing fluid, oxygen, and nutrients, and can help repair arthritic areas or disc problems, and that can give longer pain relief. as opposed to simple gravity, anti-gravity, continuous traction, where you get temporary relief. There's a video on our website, multiple. There's plenty of explanations on the blog. Type in spinal decompression, you get a lot of information there as well. I'm Dr. David Green, Preferred Pain Center. Oh, one more thing. We offer a 24-hour guarantee. We'll get you in within 24 hours guaranteed to start your treatment. Also, new patients, we offer complimentary 30-minute massages for new pain management patients. Preferred Pain Center, your pain stops here.